Hey, friends. Welcome to the podcast, The Patient's Voice. Does it matter? This is a place where your voice will always matter to me. Healthcare is complicated, so I wanted to create a space where we will discuss tips, hot topics. I'll provide resources, have guest speakers who are experts in the healthcare industry, or real patients sharing their patient experience in hopes to help you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I'm your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I'm a board-certified patient advocate. I have a passion for patients. Let's be the change together. In this episode, I'm going to talk about what is a patient advocate and do I even need one? The first part of the episode, I'm going to discuss the different kinds and what a patient advocate is and does. And the second half of the show, I'm going to ask you some questions to see if you know the answers on how to be your own patient advocate. So I want to start out about telling you about the different kinds. So there's an insurance advocate, and they work for the insurance company. There's a hospital advocate. Of course, they work for the hospital setting. There are billing advocates, and then there's independent advocates, and they work for the patient. So I'm an independent board-certified patient advocate. I work for you. My mission at my company, Hughes Advocacy, is to educate and empower patients to be proactive with their health, not reactive. I try to provide my clients with resources to help them make informed medical decisions that enhance their lives, ensuring they receive the best patient experience, safety, and quality of care that you need and deserve. My goal is to be your voice and put you back at the center of your care. As an independent advocate, I am part of your healthcare team. So some examples of medical issues as a patient advocate that I assist with are liver, brain, breast, colon, prostate cancer, any kind of orthopedic procedures, hip replacement, trigger finger, total foot construction, Alzheimer's, Parkinson's, any and all kind of heart conditions, AFib, neurologic stroke, SVT, diabetes, COPD, etc. My youngest client was just born, and my oldest client passed away at 96. And I work in facilities all across the United States. I've worked at Cincinnati Children's, MD Anderson, Mayo Clinic, Johns Hopkins, Vanderbilt. So, as an advocate, I get asked all the time if patients reach out to me before a medical error has occurred. Unfortunately, in my situation, the answer is no. Every client that has ever reached out to me is always reactive, never proactive. And there have been times when a client has called and there was nothing I could do and the patient died. I also get asked if doctors like working with advocates. I can't remember off the top of my head, but I posted it on my social media outlets, but it's something like 98% of doctors like working with advocates. And in my experience, I find that to be true. The reason doctors love working with the advocate is because we help them. I tell my clients that if your doctor does not want to work with an advocate, then it might be a red flag for you to get another doctor. So an example of how much doctors like working with advocates, Johns Hopkins on their website, and I've also linked this in the about section so you can go, look what they have to say about having a patient advocate. But they state, and I'm going to read, an advocate is not just for doctor's visits or hospital stays. A patient can discuss new health issues with their advocate. For instance, an advocate can offer a perspective on whether or not the treatment is working. An advocate can also help doctors educate you about your condition so you can better management. And your advocate's communication with your doctor can help deal with issues that are important to you. Now, as I said, the first half I was going to tell you what a patient advocate does. Now I'd like to ask you, the patient, if you've ever experienced any of these issues in the healthcare setting where your voice did not matter, or have you even thought about any of these questions before? Have you ever been gaslighted? I see this happen all the time, especially with women and minorities. For example, there's a study from 2022, and they investigated sex differences in the evaluation of chest pain, a common sign of heart attack, among young adults that came to the emergency department. This research found that women were less likely than men to be triaged as emergent, to get an EKG, or be admitted to the hospital. Are you afraid to get a second opinion? You know, good doctors encourage getting a second opinion. I just had someone tell me last week that they were scared to get a second opinion, that their doctor might fire them or cause harm if they do. Do you know how to find the right assisted living for your loved one? Does that place have deficiencies? Do you know their safety grades? How about your hospital safety grades, their mortality rates, their infection rates? Do you know how to read your medical records, access your patient portal, or have your HIPAA rights been violated? I just had a family member whose HIPAA rights were violated, and it's probably one of the number one issues that I have as a patient advocate, and we will discuss that in a later episode. Have you ever been to the doctor and they gave you a treatment plan, but you're not getting better? Do you know what to do next? Have you been misdiagnosed? Do you know, as an advocate, I can go with you to doctor's appointments, I can take notes, I can help with questions, help with medication management, coordinate your care. Most people don't even know what care coordination means, or they trust that it's being done. The sad thing is, it's rarely happening because healthcare workers are just overworked. Have you ever experienced an equity issue, whether it be race or ageism? Are you being dismissed for disagreeing with your doctor? An example of this, my dad went to the doctor, I went with him, and the doctor was pushing his agenda on my dad, and I didn't like it. I had some extra questions. He asked for a second opinion, to explain a little further. And he got so mad at me disagreeing and asking questions that he literally stuck his hand in my face and told me to hush. I immediately said, "Dad, let's go. We're getting out of here. We're getting another doctor." And I'm glad I did, because the procedure that was being shoved down our throats, my dad never needed. Your gut is always right. Have you ever been dismissed or mistreated due to mental health issues? Are you having surgery? Do you know your surgeon's complication or infection rates? And caregivers, you're overwhelmed, and sometimes you are the patient, like taking care of a loved one that's just had a stroke, who has Alzheimer's, cancer, Parkinson's, etc. These are just some of the topics that we're going to cover on this podcast to include real patient experiences. My goal is I want to empower you so that your voice will always matter, and I want to teach you how to be your own advocate. Dignity, empathy, respect, transparency, accountability, in my personal opinion, do not exist in healthcare. We're just a dollar sign. I'm not trying to be a Debbie Downer, but you do not need to trust the healthcare system. Now, I'm going to stop right there. I'm not telling you not to trust your doctor. at all. That is not what I said. I'm telling you that the healthcare system is broken. Preventable medical errors are the third leading cause of death in the United States. And when you go into a healthcare system, you need to be prepared every time you walk in that door, and you need to be a proactive, not a reactive patient. Healthcare works for us. We don't work for them. Demand the care you need and deserve. Everyone's worried that they're going to get blackballed or fired for standing up for themselves. That should never happen. And if it does, I welcome you to please let me know. Let's report how you were treated. I'm going to discuss that in a later episode at length because it is a tremendous problem. So this was just a quick snapshot of what an advocate is and what I do as a board certified patient advocate. My hope is that in each episode, you're going to learn how to be your own patient advocate. Now, I do have some exciting news that I want to share, especially on the YouTube channel. I'm going to start doing little educational videos. So that's coming in the future because like I said, I want you to be a proactive patient, but I'll let you know when those are released. However, if you do need any personal assistance in navigating the healthcare system, you can always reach out to me. At Hughes Advocacy, I offer a free 15-minute consultation. I'm not sure all states, but I know in the state of Alabama, it's a tax write-off for these services. And I offer different pricing packages. So that brings us to the end of this episode. As always, thank you so much for listening to The Patient's Voice. Does it matter? If you enjoyed the show, make sure you subscribe, like, share, follow, comment. Also, please reach out to me if your loved ones need any help. You have topics that you would like to discuss. There's resources in the about. There's a form you can fill out on topics you want to hear, or if you want to be a guest on the show to share your patient stories. But be sure to come back next time because I'm going to have a discussion on what even is patient safety. Until then, I'm Krista Hughes. And don't forget, I have a passion for patients. Let's be the change together.